Have you ever wondered why prostate cancer, one of the most common cancers in men worldwide, is so often caught late? Not because it gives no warning, but because the warnings are there and most men don't recognize them for what they are. You might have heard that prostate cancer is a silent disease, and in its very earliest stages, that can be true. But here's what most people don't realize. For a significant number of men, the body does start sending signals well before the disease becomes advanced. The problem is not that the signs are invisible. The problem is that they look exactly like things men are trained to dismiss, things they blame on getting older, things they tell themselves will go away on their own, things they feel embarrassed to bring up with a doctor. And that dismissal, that gap between the first symptom and the first doctor's visit, is often the difference between a highly treatable diagnosis and a life-threatening one. By the end of this video, you will know the 5 signs that men most commonly overlook, why each one gets dismissed, and exactly what to do if any of them sound familiar. Not to frighten you, but to give you the information that could genuinely save your life or the life of someone you care about. But before we get into the 5 signs, I need to explain something first, because understanding why men miss these symptoms is just as important as knowing what the symptoms are. And it starts with a pattern that runs deeper than most people realize. Here is the most dangerous thing about prostate cancer. It is not the disease itself in its early stages, because caught early, prostate cancer has a survival rate of close to 100%. The danger is the delay. The average man waits. He notices something, he tells himself it is probably nothing, he waits a little longer, and by the time he finally sits in front of a doctor, weeks or months have passed, sometimes years. And the reason that delay happens is not carelessness. It is something much more specific. So before the 5 signs, let's talk about why men miss them in the first place. To understand why these symptoms get ignored, we need to look at the prostate itself, where it sits, what it does, and why its location makes early warning signs so easy to rationalize away. Most men could not tell you where their prostate is or what it does, and that lack of awareness is not a personal failure, it is a systemic one. Men's health education has historically been far behind women's when it comes to teaching people to recognize and respond to early warning signs. And for prostate cancer specifically, that gap has real consequences. Here is what most men understand about their prostate. Almost nothing. It is a small, walnut-sized gland that sits just below the bladder, wrapped around the urethra, the tube that carries urine out of the body. Its primary job is to produce fluid that forms part of semen. That is roughly where most men's knowledge ends. And because men don't think about their prostate, they don't connect symptoms involving urination or sexual function back to it. When something feels off in that area of the body, the default assumption is aging or stress or something temporary that doesn't need medical attention. There is also a condition called benign prostatic hyperplasia, or BPH, which is a non-cancerous enlargement of the prostate that becomes extremely common in men over 50. BPH produces many of the same urinary symptoms as prostate cancer. And because BPH is so common and so widely known to be benign, men who experience those symptoms often self-diagnose with BPH and never get checked. They assume it is the harmless version without ever confirming that. Then there's the psychological layer. Research consistently shows that men are significantly less likely than women to seek medical attention for concerning symptoms. Fear of a bad diagnosis, discomfort with certain types of examinations, a cultural belief that going to the doctor is a sign of weakness. These are real barriers that delay real diagnoses every single day. So what we have is a cancer that in its early stages produces subtle, easy to rationalize symptoms in a population that is already predisposed to dismiss those symptoms and avoid medical checkups. That combination is exactly why prostate cancer is so frequently caught later than it should be. Not because the signs weren't there, because nobody taught men what to look for or gave them permission to take those signs seriously. Here's what I want you to take from this. The symptoms are not the problem. The dismissal is. Every sign we are about to cover has a reasonable-sounding alternative explanation, and that is precisely what makes it dangerous. The goal is not to panic every time you have a minor urinary issue. The goal is to know your baseline, notice when something changes, and take that change seriously enough to get it checked. That is it. That is the whole lesson. So let's get into the signs themselves. We're going to start with the 3 that involve urination and visible physical changes, because these are the ones that appear earliest and are most commonly explained away before a man ever sees a doctor. Here's something worth sitting with before we go through these first 3 signs. The prostate wraps directly around the urethra, so when the prostate is affected, whether by cancer, by inflammation, or by benign enlargement, the urinary system is almost always the first place the body registers it, which means that changes in how you urinate are not a minor inconvenience to manage with a lifestyle adjustment. They are your body's most direct communication channel about what is happening in that part of your anatomy, and they deserve to be treated that way. Think about the last time a man you know, a father, a brother, a friend, maybe yourself, mentioned waking up multiple times in the night to use the bathroom, and think about the response that comment probably got. A laugh, a joke about getting older, a knowing nod, because in most circles, disrupted sleep from nighttime urination is treated as a completely normal part of aging from men past a certain age. It has become so normalized that it barely registers as something worth mentioning to a doctor. Sign number 1, frequent urination, especially at night. The medical term for waking repeatedly to urinate is nocturia, and while it does become more common with age, it is not simply a fact of life to be accepted without investigation. When the prostate enlarges or is affected by abnormal cell growth, it can press on the bladder and the urethra, creating a persistent sense of urgency and reducing the bladder's effective capacity. Waking once in the night occasionally is one thing. Waking 2, 3, or 4 times consistently, or experiencing a sudden increase in daytime urinary frequency, is a pattern that warrants a conversation with your doctor. Not an assumption, a conversation. Sign number 2, difficulty starting or stopping urination. This one is perhaps the most commonly dismissed of all the urinary signs. A weak urine stream, hesitancy before urination begins, a stop-start flow, or the sense that the bladder never fully empties. These are all symptoms of the urethra being compressed or obstructed. And because they develop gradually over time, men often don't notice how significant the change has been until it is pointed out to them. The comparison point is not other men, it is your own baseline from years earlier. If something has changed and stayed changed, that matters. Sign number 3, blood in urine or semen. This is the one sign on this list that should never be rationalized or waited out. The medical terms are hematuria for blood in urine and hemospermia for blood in semen. Either one can indicate damage, abnormal growth, or disruption in the prostate or urinary tract. The reason men dismiss it is often because it appears once, perhaps a faint discoloration, and then seems to go away. But the absence of a repeat occurrence does not mean the underlying cause has resolved. Blood where it should not be is always a reason to see a doctor, not eventually, promptly. These 3 signs, taken individually, each have an innocent-sounding explanation readily available: aging, BPH, dehydration, a one-off. But together, or in combination with other changes, they form a pattern that no man over the age of 50 should be comfortable ignoring. And even before 50, particularly from men with a family history of prostate cancer, any of these signs warrants medical attention. Here is the key takeaway from these 3 signs. None of them individually proves prostate cancer. What they prove is that something in that part of your body has changed and deserves professional evaluation. The doctor's job is to determine the cause. Your job is to show up and report what you've noticed. That division of responsibility is important because too many men take on the doctor's job themselves, decide it's probably nothing, and never make the appointment. If any of these 3 signs are present, especially if more than one is present at the same time, or if they have persisted for more than a few weeks, book an appointment. Not because it is definitely cancer, but because it is definitely worth ruling out. Now, the last 2 signs on this list are different in character from the first 3. They tend to appear later in the progression of the disease, and they are the ones most likely to be misattributed to completely unrelated causes, which makes them in some ways the most dangerous signs of all. Here is what happens when prostate cancer is not caught in its early stages. It does not stay contained to the prostate. It spreads, most commonly to the bones, particularly the spine, hips, and pelvis. And when it does, it announces itself in a way that feels completely disconnected from the prostate. A persistent ache in the lower back, hip pain that won't resolve, a deep discomfort in the pelvis that seems to have no obvious cause. These are not signs most men would connect to their prostate, and that is exactly why they are so often the point at which advanced disease is finally discovered. Picture a man in his late 50s. He has been dealing with lower back pain for several months. He assumes it is from sitting at a desk, from an old injury, from the general wear and tear of getting older. He takes over-the-counter pain relief, he stretches, maybe he sees a physiotherapist, and the pain persists. It does not follow a pattern that makes sense for a musculoskeletal issue. It does not improve with rest. It does not worsen with specific movements in the predictable way a muscle injury would. But because back pain is so common, it takes a long time before anyone thinks to look deeper. Sign number 4, persistent pain in the lower back, hips, or pelvis. When prostate cancer spreads beyond the prostate, bone metastases, meaning cancer that has traveled to the bones, is the most common destination. The spine, hips, and pelvis are the areas most frequently affected. The pain from bone metastases is typically described as deep, dull, and persistent. It does not behave like muscle pain or joint pain. It does not follow the pattern of common back conditions. It tends to be present at rest as well as during activity, and it may be worse at night. Any unexplained, persistent pain in these areas, particularly in a man over 50 with other risk factors, should be investigated, not managed indefinitely with painkillers. Number 5, erectile dysfunction. This is perhaps the most sensitive sign on this list, and the one men are most reluctant to discuss. Erectile dysfunction has many causes: cardiovascular issues, diabetes, stress, medication side effects, hormonal changes. And because those explanations are so readily available, the possibility of prostate involvement is rarely the first place men's minds go. But the prostate is closely surrounded by nerves and blood vessels that are directly involved in erectile function. Abnormal growth or inflammation in the prostate can affect those structures. Erectile dysfunction that develops gradually, persists, and is not explained by an obvious cause, particularly when it appears alongside any of the other signs we have discussed, deserves to be part of a broader conversation with a doctor about prostate health. If you are a man over 50 or over 40 with a family history of prostate cancer, the most important thing you can do right now is talk to your doctor about PSA screening. PSA stands for prostate-specific antigen. It is a protein produced by the prostate, and elevated levels in the blood can indicate abnormal prostate activity, including cancer. It is a simple blood test. It is not perfect, it can produce false positives, and it requires clinical judgment to interpret correctly, but it is currently the most accessible and widely used tool for detecting prostate cancer before symptoms become severe. The other screening tool your doctor may use is a digital rectal exam, a brief physical examination that allows a doctor to directly assess the size and texture of the prostate. Many men avoid this examination out of discomfort or embarrassment, but it takes less than a minute and it has detected cancers that blood tests alone missed. Beyond screening, know your risk factors. Age is the single biggest one, with risk increasing significantly after 50. Family history matters. If your father or brother had prostate cancer, your own risk is meaningfully higher. Certain ethnic groups, particularly men of African descent, face a higher statistical risk, and lifestyle factors including obesity, a diet high in processed foods, and physical inactivity have all been associated with increased prostate cancer risk in population research. Here is the final lesson, and the one I most want you to carry with you. Early prostate cancer, caught through screening before significant symptoms develop, has a near 100% 5-year survival rate. Advanced prostate cancer that has spread to bones and other organs is a fundamentally different situation. Treatable in many cases, but far more complex, far more aggressive in its treatment requirements, and far less predictable in its outcomes. The gap between those two scenarios is almost entirely determined by one thing: how early the conversation with a doctor happens. Not how serious the symptoms feel, not how bad the pain gets. How early the man decides that his health is worth a doctor's appointment. So if you are watching this and any of these 5 signs sound familiar: frequent nighttime urination, a weak or interrupted urine stream, blood in urine or semen, persistent, unexplained pain in the lower back or hips, or erectile dysfunction without a clear cause, please make that appointment. Not because this video diagnosed you with anything, because your body may be telling you something worth listening to. Men's health does not get talked about enough, not with the seriousness it deserves, not with the clarity that actually helps people make better decisions, and that is exactly what this channel is here to change. If this video gave you information you didn't have before, if it made you think about your own health or the health of a man in your life differently, then please hit subscribe, because we cover topics like this every week. Real health information explained plainly, without the fear-mongering and without the agenda. And share this video. Send it to your father, your brother, your husband, your friend, because sometimes the most important thing you can do for someone you care about is put the right information in front of them at the right time.